Good evening, Board Chair Jones, Dr. Hargens, and members of the board. We are happy to share this annual board governance training as required by Head Start law. I'm Ballard High School correspondent Laurel Deppin. If we were going to provide a comprehensive training this evening, it would require at least 6 to 8 hours. We have decided to focus on a few of the Head Start standards in an effort to ensure you have a better understanding of a few standards. Head Start Act states, training and technical assistance. Appropriate training and technical assistance shall be provided to the members of the governing body and the Policy Council to ensure that the members understand the information the members receive and can effectively oversee and participate in the program of the Head Start agency. In order to best support these children, we must provide comprehensive and holistic supports to children and families so that, as a result of the program, children will be ready for kindergarten. And we know that it is not just letter recognition that gets a child ready. Child development and education. This includes providing individualized attention to children so that we meet the needs of all children, including children with disabilities. Working with children and families with disabilities is actually a very important part of the program, and we're actually required to serve at least 10% of enrolled children that have special needs. Health and safety. If children aren't healthy, they won't be able to learn or participate in school, and so it is a critical piece of Head Start services. In this chart, the green bar represents the lowest socioeconomic status and the orange bar represents the highest economic status. Here you can see the gap. If we look at recognized as letters, children of high SES doubled, actually even a little more than doubled their skills in this area as compared to the children born in low SES. The other areas captured here are counts to 20, writes own name, and identifies initial sounds, which has a particularly large disparity. Results of last year's training. Eligibility, recruitment, selection, enrollment, and attendance, ERSI. Created an ERSI team, approved ERSI plan. Keeping the board informed, monthly one-pager. Self-assessment, underway. Monitoring, new system. In your folder, you will find a 2-page document which lists everything you are required to understand by law as the governing body of the Head Start grant in Jcps. Tonight we will focus on 3 areas. We have highlighted those 3 laws on your handout. Developing procedures for how members of the Policy Council are selected, consistent with paragraph. Approving financial management, accounting, and reporting policies in compliance with laws and regulations related to financial statements. Reviewing results from monitoring conducted under Section 641A, including appropriate follow-up activities. This is a visual representation of roles and responsibilities for shared governance, and it is in your binder if you'd actually like to read what's on this slide. Focus your attention on the overlap sections, the areas that governance shares with Policy Council, with management staff, and with both Policy Council and management staff. What's important to note is the flow of the reports that go along with these shared responsibilities. The Head Start Policy Council is similar to a large SBDM council that serves Head Start. Parent members are elected by other parents. Each section of the city is divided into districts in order to have equal representation. Community members are elected by parents once they are on the Policy Council. Similar to an SBDM council, the Policy Council must approve policies, the self-assessment, and the community assessment. They receive and review the same monthly information provided to the board. The Policy Council is involved in hiring of any employee funded by the Head Start money. They help establish the budget for the coming year. Each month, they must receive a financial update, number of meals served, student enrollment, and attendance. The Policy Council meets on the 3rd Thursday of every month. When selecting Policy Council members, 1 parent member from each achievement area, 3 parent members from curriculum and instruction, 1 parent alternate from each achievement area, 3 parent alternates from curriculum and instruction, 8 community members. The JCPS system of internal control consists of the Office of Head Start and the Policy Council, which are looked over by Early Childhood. Early Childhood is looked over by Grants and Awards. Grants and Awards are looked over by Financial Planning, which is looked over by the JCPS Financial Services. JCPS financial services are looked over by the Jefferson County Board of Education. And finally, the Jefferson County Board of Education is looked over by external auditors. The Head Start self-assessment process is exactly what it says: a self-review of all files, including health files, family files, and financial files. A review of selected classrooms is conducted to make sure regulations are being followed. Part of the self-assessment is a safety check. This includes bus rides, playground inspections, classroom visits, surveys, parent interviews, and community interviews. Each year, we can change the items we are assessing in order to cover most regulations over a period of a few years. The community assessment is usually done by an outside agency and can include demographics of populations served, any changes to the populations, surveys from parents and community members on how to better serve them. It is basically a snapshot of the population you serve. This document, along with the self-assessment, should drive the program options year to year. There is a new insight monitoring system. Head Start agencies are required to report any safety concerns, such as a child left on the bus or allegations of abuse by an employee. Each user's dashboard is customized for their role and/or caseload. You will only see enrolled children in the programs, centers, classrooms, and caseloads to which you are assigned. Teachers only see the students in their classroom. Family service workers only see their caseload. Site administrators see all students at their location, and so on. Next to each child's picture on the dashboard, a red bell icon with a number represents child alert points. The points are calculated by compiling the items or needs that are outstanding or upcoming for each child, such as missing or expiring health documents, screenings, and family service goals. The children on the dashboard are automatically sorted based on their alert points, which allows for quick prioritization of your workload. The students with the highest numbers are the students who are at most risk and require the most immediate attention. The student's profile page gives a quick snapshot of important information, such as proactive alerts indicating items that are expiring or past due, status overview including goals progress, attendance overview, and strength, as well as general student enrollment information. Calendar organization tracking family service items which are due. Easy to produce, managed by information (MBI) reports offer drill down reporting. With a single click, the user can navigate from program center level down to classroom level, down even further to item level, and beyond that to student level. Item level view allows the user to see all items that are coming due and/or expiring for the students within the class. Children level view allows the user to look at the specific documents for an individual child. By using child alert points to prioritize your workload in conjunction with drill down reports, focus is on problem areas, missing and expired documents, family service goals, and etc. The user can then document the follow-up steps taken to correct the issues. Shine Insight allows for the tracking of goals with follow-up notes and the ability to add attachments as needed. Shown here is an example of a family goal follow-up. Shown here is an example of the fields used to record concerns and follow-ups for a health screening. The requirements for family services include family engagement outcomes, family partnerships, attendance, goal setting status, goal setting progress, services received for PIR submission, and case note follow-ups. Board members, thank you for watching our presentation. Representatives from early childhood are here to answer your questions. I'm Ballard correspondent Laurel Deppin.